Hi, I'm Dr. John Gray, and we're here with John Gray Chiropractic. And today, what we're going to talk about is why it's beneficial for you to try a conservative approach first for your shoulder. In fact, the latest research shows that conservative approaches compared to surgical outcomes are not much different. You just have to be a little more patient on the front end, and with the surgeries, you have to be more patient on the back end. So, and then there's of course a cost. And the one thing that they don't talk about a lot is when you do have a surgery, you have two factors that'll work against you from there forward, and that's the scar tissue that's created from the surgery, and then also you create a surgical hernia in that area. In other words, anywhere where you cut, you're going to have a little more weakness in that area, just like you would if you had a regular hernia, just a weakness in that tissue. So that's something to consider as well. Let's get into it. So we have Tommy Bones here with us today, and he's going to help us a little bit understand how the shoulder's made up. The first thing we want to recognize is, as you can look here in the shoulder, compared to the hip, is not really a ball and socket joint. It kind of free floats out there. So we have four structures, and really five structures that we're interested in when we talk about it. The four structures are the rotor cuff muscles. They're muscles that attach from here. They help turn your shoulder out. We have some muscles that come down this valley here and come over the top, and that helps raise the arm. And then we have some muscles here in the front that help with the bicep tendon. That usually gets frayed when the other ones wear out. And then we have some muscles that go into our chest here that help push it forward or bring it across or internally rotate. And so those are the ones we're going to talk about today. Now, the fifth structure we're interested in is there's a little material that comes off this back piece here. If you can see that, it's on a scapula, and that comes out into there. And we call that the labrum. And that's a connective tissue that is the kind of the structural integrity of keeping that bone in its place while these muscles fire on it. If that one gets hurt, that becomes much more problematic. Today, what we're going to talk about are the four areas of the shoulder that we can work with and why it's beneficial to do it, what we basically do conservatively. So let's talk about the first one here. We'll call this this is the supraspinatus, and that comes out and hooks into the top of the joint there. That also is what helps us move the head to where it wants to position before we fire the other muscles. That's one of the reasons why this area is one of the more common ones that we get hurt when we hurt our shoulder. When this gets hurt, it usually is a combination of things. One, you can have a little laxity in that labrum, so it's allowing it to drop or move on it too much. Two, you can be bumping into this bone here a little bit. That is usually a result of one of two things. One, you can be having spurring that's occurring there just from arthritic style conditions, or two, because of posture or because of weakness in the other areas, that area is impinging into that area and it's causing a fraying of that muscle. So the first thing we want to do is assess why that's being caused that way. We can take a picture of that, see if you have any bone spurs in that area. If you don't have bone spurs in that area, then we go to work at moving that shoulder blade back. In other words, I'll show you. So if I have a shoulder blade that rides forward, when I go to raise my arm, I'm going to bump into that bone that's on the end. This is the bone that's in that end. So when I bump into it, that's going to fray that. So if I can move my shoulder blades back and improve my posture, then I'm going to start having more clearance versus this. I'm not bumping into it as much. The next thing we have to do is we have to relax that tissue and increase the blood supply to it so it can heal. When I say relax to it, a lot of times when muscles tear, they will bunch up and they'll spasm into little clumps around there, trying to rope up basically so that they don't get torn any further. But we need to lay those down so that they don't keep pulling on that torn spot, and you'll have spasms up into here, and there's soft tissue techniques that we do for that. We also have soft tissue techniques that increase blood supply, and we have technology that'll go in there and it can put sound waves in and increase your blood supply in that area, as well as exercises. One thing that will prevent that from being successful right off is if you're having something more called frozen shoulder. And that's when you start to notice that it's gone on long enough that you're losing motion. In other words, you can't get it into certain positions. That's usually a little more advanced. The nice thing is, as a chiropractor, there's adjustments that we can do for that, and we use a specialized table or different equipment that we can help break up that scar tissue that's causing that, or if it's a positional thing, we can help that shoulder get back into position. Now that'll be temporary at first, because if you have structural integrity issues, we have to do things to build that shoulder up and work with that with you. But it goes much quicker than some of the stuff that I used to see when I worked initially in physical therapy, where we used to have protocols and that you just would stretch the heck out of that shoulder, and that would cause more inflammation and a lot of pain to the patient. So that'll help with that, and we've come a long way into getting that to just do little nuances, little small movements or adjustments to that area that help get it so that we can start working with it and strengthen it through its range of motion. Now, of course, if those integrity points have become compromised to the point where you do need a surgical improvement to that, then we'll let you know. And that's part of the service that we do here, because we've seen a lot of these. We see 1,000 patients with this every year. We have a good idea about when it's gone too far now, and we can help get you to the right place for that. Otherwise, research shows and our experience shows that our approach will get you the best results possible out there. Next week, we'll talk a little bit more about some of the other muscles and what you can do for those and how you can tell if you have some of that problem. Until next time, this is Dr. John Gray, and I'll talk to you next week. Hey, thanks for watching the video today. If you liked what you saw and you don't want to miss any future videos that go over performance-based, evidence-based care and actionable solutions for you that are sustainable, in other words, things that don't require surgery and don't require drugs, don't forget to like and subscribe, and those videos will come to you. And if you have any questions or things you'd like us to cover, feel free to leave questions in the comment section below.